If you're ever wondered how to get perfect X-ray images of the foot, you are in the right place. Hello. Welcome to our radiography tutorial series. In today's video, we'll be exploring the essential radiographic techniques for imaging the toes. Whether you're a radiography student or a professional, this guide will enhance your imaging skills and precision. So let's get started. For the toes imaging, we have AP oblique, and lateral. For the AP imaging or AP axial, our patient must be either supine or seated on a table with their knees flexed and their feet separated. We must center the toes with their plantar surface flat against IR. Our central ray is angled 15 degrees posteriorly, so we can have a better image of the joints. We must position it so the central ray enters the third MDP joint, and we have to use the perpendicular central ray when the joint space are not crucial. Our collimator is the same as any other techniques that we use for the imaging of the fingers. 1 inch or 2.5 centimeters on all sides of the toe, including 1 inch or 2.5 centimeters proximal to the MDP joint. As a quick reminder, if you're finding this information useful, don't forget to subscribe to our channel and stay updated with all our detailed tutorials and professional tips. Now, let's move on to the next projection. For the medial rotation variation of AP oblique imaging, we must position our patients so they're seated or supine on the table with their knees flexed and feet separated. We must center the toes over the IR area and medially rotate the leg and foot until a 30 to 45 degree angle is forward from the IR to the plantar surface of the foot. Our center is perpendicular and entering to the third MDP joint. Our collimator is 1 inch or 2.5 centimeters on all sides of toe, including 1 inch or 2.5 centimeters proximal to the MDP joint, and our KDP is 63. For the lateral imaging of the toes, if our interest is the great or the second toe, we must position our patient on the unaffected side. But if our interest is the third to fifth toe, we must position our patient on the affected side. We must adjust the foot so the affected toe is parallel to the IR and in true lateral position. We have to use gauze, tape, or other positioning aid to separate the toes, so there is no superimposing. Our central ray is perpendicular to the IP joint of great toe or the PIP joint of the second through fifth toe, and our collimator is the same as any other toe technique, with our KDP being 63. Thank you for watching our detailed tutorial on toe imaging techniques. We hope this video has provided you with valuable insights and practical tips for your radiographic practice. Don't forget to subscribe to our channel for more in-depth content on radiographic procedures and updates in the field. If you have any questions or suggestions, please leave them in the comments below.